You might think that the person nominated to lead our nation's top health department, an agency with a budget of over $2 trillion, and responsible for running everything from Medicare to vaccine trials, you might think that that person would at least be interested in, if not experienced in, curing diseases and promoting public health, that they'd be someone who follows science and works to build the public's trust in it. Robert F. Kennedy Jr. is none of those things. For the first time ever, we might have a health secretary who has actively fueled disease outbreaks. He has literally made a career out of lying about the safety of basic vaccines, and it is not an exaggeration to say lives will be lost if he is confirmed. He has cost lives pretending to be a public health expert before, and he will do it again at scale if he becomes the next health secretary. This is not just some random dude with his buddies kicking around weird ideas just for the hell of it. He's a Kennedy with an enormous fortune, parachuting into countries to tell lies and stop people from taking life-saving vaccines. In 2019, he flew to Samoa to discourage people from taking the measles vaccine, deepening a hesitancy that was already building. And it did work. Vaccination rates for eligible one-year-olds fell below 33%. And just 5 months later, Samoa found itself in the middle of a measles outbreak. 5,000 people got the measles. 83 people died because RFK Jr. decided to leave the east coast of the continental United States and fly clear across the Pacific to Samoa to tell people not to take the measles vaccine. This is the nominee for the Secretary of Health and Human Services. In addition to spreading baseless lies about vaccines, he has also regularly spouted all kinds of deranged ideas, including, this is a direct quote, COVID was, quote, targeted to attack Caucasians and black people. The people who are most immune are Ashkenazi Jews and Chinese. He also claimed without any evidence that antidepressants are to blame for mass shootings and that chemicals in our water are turning our kids gay. I don't know why this guy is going to get a single vote. This isn't just somebody who has like a different view than me on mandatory COVID vaccinations. There is a lot of room for reasonable people to disagree about the conduct of the government, state, federal, county, as it relates to the COVID vaccine and the COVID response. In a global pandemic, people, all of them, in every state, everybody was trying their best. And there are a lot of lessons to be learned, including a kind of close call about whether mandatory vaccinations in the context of COVID, as it was on the downslope, even worked. But we're not talking about that. We're talking about measles, mumps, rubella, polio. His plans to remake the Department of Health and Human Services are equally terrifying. He wants to revoke approvals for the polio and Hep B vaccines for children and roll back guidance on other vital vaccines. There's a reason that we haven't had to think about these awful, painful diseases in a long, long time, and it's because we've vaccinated our way out of outbreaks. He's also vowed to fire hundreds of federal health researchers and scientists and stop all research into infectious disease and vaccine development because, quote, we're going to give infectious disease a break for about 8 years. We're going to give infectious diseases a break for about 8 years. This is as dangerous of a decision as the United States Senate could possibly take. You would honestly not put him in charge of a local clinic, let alone the country's entire health system. And look, I get it. I come from Hawaii. A lot of my constituents hear his critique of our food system and agree. Our food system is broken, and people are getting sick because of it. We have subsidized the wrong things for so long that you can find an unhealthy meal faster and cheaper than a healthy one. Ultra-processed foods are everywhere, and healthy and hearty meals are harder to come by, and that has to change. But we don't have to bring measles and mumps back in order to fix our food system. We don't have to bring back the horrors of polio in the name of cleansing our diet. And there are a lot of people in the Senate, including my dear friend, Senator Cory Booker, who works really hard to solve this problem with the seriousness and the thoughtfulness that it deserves, to rein in factory farms, to empower family farmers, to make healthy food more readily available and affordable. We have to do all of that. But we don't have to purchase with this idea that our food system is broken, the idea that the only way we can fix our food system is if we bring polio back, if we bring measles back, if we bring mumps back, if we bring rubella back. The medical profession at its best is about helping people. And I think about doctors like my dad, Dr. Brian Schatz, aboard a hospital ship, the SS Hope, providing free medical care to people across Latin America. So many like him put their lives and their careers on hold to travel far and wide to care for the less fortunate, helping kids with cleft palate, distributing mosquito nets, delivering babies, treating and preventing diseases. It is hard and unglamorous and unselfish work. It is God's work. And so it takes a special kind of person to do the exact opposite, to do what this man did, which is fly around the planet to cause disease, to fly around the planet to cause disease. So yes, this is a question of character and competence, but it's also a question of life and death, and who we want in charge making decisions when lives are on the line. And it is our job here in the Senate to make damn sure that we protect the public health. I could not urge more strongly a no vote on this unqualified nominee. I yield the floor.